Hey friends, this is Dr. Ryan. We're in Lakeshore Integrated Health, and today I have my patient Carly with me. And so she's been having low back pain and knee pain for quite some time. She's been a chiropractic and decompression patient. Today we're trying shockwave to kind of get the knee a bit more loosened up, but we're also doing Emsculpt NEO. So we're going to show you that setup in just a minute. So as I said, we're going to try Carly on Emsculpt NEO today, and we're going to get this set up pretty much right now. What I'd like to do is give this to you. That is your safety button. Go ahead and hold on to that. Okay, and we're gonna get started, okay? Oh, go ahead and press that button for me.
This one?
Yep. Cool. All right, so, well, let's go that. Okay. First thing that we're going to do is turn on the RF. That's the heating portion of it that I told you before. Okay, so we're going to start with 90. Now, you're not going to feel anything with that. It's just heat. Okay? But now what you are going to feel is the high FEM. So we're going to, immediately, right? So what we're going to do is we're going to probably get you to call it 15% and just let it sit for a second. The overall placement of the knee is right on top. She's having pain on the inside of the knee, and it's been driving her nuts for a long, long time. We've tried adjustments, we've tried decompression, we've tried shockwave, as you just saw in the previous video. But today we're doing the Emsculpt functional setting, and the main purpose for this is muscle re-education, okay? Teaching your joint the full range of motion it's supposed to have, and it also gets rid of some of the muscle spasms and some of the reasons why this is being painful. So how's the pain right now? It's pretty easy.
Hurt.
I mean, it shouldn't, yeah. So,
it's like a buzz.
So okay, hold your tongue. So we're gonna go up to, let's call it 45%, okay? You're gonna notice a little bit more intense, but it should still be pretty reasonable, okay? Yeah.
It's just like tiny muscle spasms.
That's the idea. So again, this is not to cause this big muscle contraction, it's to loosen up the muscle fibers. In fact, elongating the muscle fibers. You'll kind of see that in a second here too. Let's go up a little bit higher. I'm going to say 55.
Go for it.
Okay.
Oh, they're more insistent now.
Mm-hmm. And now, say we crank this up to like 95, your muscle in your leg would be very visibly.
That's
okay.
fun.
Pretty cool, right?
Yeah.
Say a minute and change, and then we'll crank it up a little bit further, okay?
Yep.
Cool. So literally as we're in here working on Carly's boyfriend is actually complaining about a similar pain that we haven't mentioned before, so we're going to talk about him. We're going to talk about the couple things that are different between shockwave and Emsculpt NEO. Shockwave is actually breaking down muscle tissue and adhesions and stuff like that, so think about tissue breakdown. Emsculpt NEO is the exact opposite of that. It's building up muscle tissue and elongating the fibers, strengthening the fibers, and then again the neuromuscular re-education, which is training your joint to understand that it does have a full range of motion. Probably a bit of both would actually be beneficial for pain, but most people respond faster to NEO. So Emsculpt NEO makes a couple different claims, the first of which is osteogenesis. And the reason they can do that is because when you go through a really intense exercise, your body starts building bone density, right? So it's really good in multiple ways. It also increases circulation. So if you went and did a really intense exercise, yes, you'd get increased circulation, which means basically lymphatic drainage, a whole bunch of other good things that they claim, and it's because you did a really intense exercise that you didn't really have to work very hard for. That's sort of the whole point. And again, the high FEM contractions are only making that area contract, so you're just relaxing right now, right? Like raise your hands up. Your hands are totally unaffected, right? Yeah. Cool, awesome. Okay, so here are the many different clicks that you're hearing right now. So when we do this for 30 minutes, you're gonna get 20,000 contractions. Sometimes it's gonna be a little bit more intense than others. I personally think the knee is one of the more enjoyable areas, but it's the most intense workout that you're ever gonna be able to do, shy of going to the gym and potentially hurting yourself afterwards. At the end of the day, our goal is always simple: figure out why something isn't functioning correctly and find the right combination of therapies to help support recovery and movement.